I became a nurse to save lives. But nothing prepared me for the day a hospital put a price tag on a man's arm. The buzzer went off at 6:53 a.m., and I knew it was going to be one of those days. I was in the supply room, restocking trauma bay equipment for the third time that morning. We'd already had 2 car accidents and a fall from a ladder when the overhead speaker crackled to life. Level 1 trauma incoming. Factory accident, severe arm injury, ETA 7 minutes. All available staff to Trauma Bay 3. 7 minutes. That's how long I had to prepare a room for someone whose life was about to fall apart. My name is Rebecca Torres. I'm 34 years old. I've been an ER nurse at St. Luke's Regional Medical Center for 9 years. I've held the hands of dying patients. I've helped bring people back from the edge. I've seen things that would break most people. But 6 months ago, I watched something that didn't break MIT, shattered me completely. I watched a man have to choose between keeping his arm and keeping his family financially alive. And the worst part, I couldn't do anything to stop it. I could only stand there, hold his hand, and watch the system destroy him piece by piece. This is the story of Marcus Harrison. But it's also my story. The story of how I learned that being a good nurse means nothing when the system treats patients like billing codes instead of human beings. And it's the story of why I'm not a nurse anymore. When the call came in, I grabbed everything I knew we'd need for supplies: blood pressure cuffs, sterile gloves, trauma shears to cut away clothing. My hands moved on autopilot after 9 years of this work. But I also grabbed something else: the phone number for patient financial services. Because I'd learned the hard way that in American emergency rooms, you need to prepare for 2 emergencies, the medical one and the financial one. I met the ambulance in the bay. The paramedics wheeled Marcus in fast, their faces tight with concern. That's always a bad sign. Paramedics see everything, and when they look worried, you know it's serious. "Rebecca, this one's bad," Jamie, the lead paramedic, said quietly as we moved the gurney. Arm caught in a hydraulic press, multiple fractures, extensive tissue damage. He's been asking about his arm the whole ride. I looked down at Marcus Harrison. He was pale, sweating, his eyes glazed with pain, despite whatever medication they'd given him. But what struck me most was the fear in his face. Not fear of pain, but fear of something else, something deeper. His right arm was splinted and wrapped, but I could see the swelling, the unnatural shape beneath the bandages. 9 years of experience told me immediately, this was going to be a complicated case. What I didn't know yet was just how complicated could get. We got Marcus into Trauma Bay 3. Dr. Chen was already there. She's one of the best trauma surgeons we have. The kind of doctor who fights for every patient, every limb, every chance. "What do we have?" she asked, already pulling on gloves. Jamie gave her the rundown. 38-year-old male, right arm caught in industrial press at 6:47 this morning. Obvious deformity, multiple fractures, what we call a severe compound fracture, which means the bones broke and came through the skin. Blood flow to the hand is weak. Patient is conscious, alert, but in significant pain. I started cutting away Marcus's jacket while 2 other nurses began setting up IVs and monitors. This is the part of nursing people don't see: the organized chaos, the way we're doing 15 things at once while making it look calm for the patient. "Mr. Harrison," I said gently, "I'm Rebecca. I'm going to be your nurse today. I need to get some IVs started so we can give you better pain medication, okay?" He nodded, but he wasn't really looking at me. He was staring at his arm with this expression I'd seen too many times: the look of someone watching their entire life change in real time. I've seen that look on cancer patients when they hear the diagnosis, on parents when we tell them their child didn't survive, on people who know, in their gut, that nothing will ever be the same. Dr. Chen started her examination. I watched her face carefully. After years of working together, I could read her expressions. And what I saw made my stomach drop. She was concerned. Really concerned. "Marcus," Dr. Chen said, her voice calm and professional. "I'm Dr. Chen. I need you to focus on what I'm about to tell you." I kept working, checking. His blood pressure elevated. which was expected. Getting the 4-line in, he barely flinched, monitoring his oxygen levels, but I was listening to every word, because I knew what was coming next. I'd been through this too many times before. Dr. Chen explained the injury. Severe damage to the arm. Multiple broken bones, damaged blood vessels, torn muscles. She laid out 2 options. Try to save the arm through complicated surgery, or amputate below the elbow. I expected Marcus to immediately say save it, that's what most patients say. But instead, he asked, how much does it cost? I felt my heart sink. Dr. Chen tried to redirect. Let's focus on the medical decision first, but I knew it wouldn't work, because I could see Claire from Patient Financial Services already hovering near the door. Claire is not a bad person. She's actually really kind. But her job is to enforce the hospital's billing policies, and that means having conversations that no one should ever have to have in an emergency room. Dr. Chen, Claire said quietly, pulling the doctor aside. I need to brief you on the insurance situation. I kept working on Marcus as for checking his monitors, making sure he was as comfortable as possible, but I was listening. We all were. The other nurses, the techs, everyone in that room knew what was happening. We'd all seen it before. Claire's voice was low, but in the quiet of the trauma bay, I could hear every word. Pre-authorization required for procedures over $50,000. The arm surgery would be about $80,000. The amputation is $25,000 and fully covered. I looked at Marcus. He'd heard it too. I watched his face change, watched hope drain out of it like water from a cracked glass. That's when his wife arrived. Where is he? Where's Marcus? A woman rushed through the door, her face streaked with tears, her hands shaking. Mrs. Harrison. I stepped toward her. I'm Rebecca. I'm taking care of your husband. He's stable right now, but she pushed past me, not rudely, just desperately, and grabbed Marcus's good hand. Oh my God, Marcus. Oh my God, I'm okay, Jen, he said, but his voice was shaking. I'm okay. He wasn't okay. We all knew he wasn't okay. Dr. Chen explained everything to Jenny, the medical situation. The surgical options, the insurance problem, the costs. I watched Jenny's face go through the same transformation Marcus's had. Fear to confusion, to understanding, to horror. $16,000 out of pocket. Jenny's voice cracked. For the first surgery. We don't, ... We don't have that kind of money. Claire stepped forward. There are payment plans available, and we can discuss payment plans, Jenny repeated, and she laughed, but it wasn't a real laugh. It was the sound of someone realizing they're trapped. Payment plans for my husband's arm. Like it's a car. Like it's a piece of furniture. I wanted to say something. Wanted to tell her I was sorry, that this wasn't fair, that the system was broken. But what could I say? I was just the nurse. I didn't make these rules. I just had to watch people break under them. Dr. Chen gave them time to talk, said she'd stabilize the arm and give them 45 minutes to decide. Then she left the trauma bay, and I could see how much this was affecting her too. But she got to leave. She got to step out, take a breath, collect herself. I had to stay. Because someone had to keep monitoring Marcus's vital signs. Someone had to adjust his pain medication when he winced. Someone had to check the blood flow to his damaged arm every 15 minutes. Someone had to be there. That someone was me. And that's what people don't understand about nursing. We're not just there during the medical crisis. We're there during everything else too. The fear, the grief, the impossible decisions, the moments when people's lives fall apart. We hold the hands that are shaking. We bring the tissues when someone starts crying. We stand there in the corner, doing our job, while people go through the worst moments of their lives. Marcus and Jenny were trying to whisper, but I could hear them. The room was too small, too quiet, and I was too close. If we borrow against the house, Jenny was saying. We can't risk the house, Jen. What if the surgery doesn't work? What if I can't go back to work? What if it's your arm, Marcus? I know it's my arm. I busied myself with his monitors, pretending I wasn't listening, giving them what little privacy I could, but I heard every word. I heard them trying to do math that no one should ever have to do. How much is an arm worth in dollars? How much debt can a family survive? What do you sacrifice when the choice is between body parts and financial ruin? Another nurse, David, came to the door. Rebecca, Bedford needs attention. The chest pain patient. Can someone else take it? I asked quietly. I can't leave this patient right now. David looked at Marcus and Jenny, understood immediately, and nodded. I'll cover it. That's another thing about nursing. We're always juggling. There were 12 other patients in the ER that morning, all needing care, all deserving attention. But I couldn't leave Marcus and Jenny alone during this. Even though I couldn't fix their problem, I could at least be there. Be a witness. Be a human presence in a system that was treating them like numbers on a spreadsheet. Claire came back in. Mr. Harrison, I have an update from your insurance company. I watched Marcus's face light up with hope. Maybe they'd approved it. Maybe this nightmare was about to end. They've denied the pre-authorization, Claire said. They're saying the amputation provides adequate treatment with less risk. However, you can appeal the decision, and we can proceed with surgery while the appeal is pending. But if the appeal fails, you'd be responsible for the full cost. The hope died in Marcus's eyes. How long does an appeal take? Jenny asked. Usually 30 to 60 days. We don't have 30 days, Marcus said. She said I have less than 2 hours. He meant Dr. Chen. She'd explained the golden window, the limited time we had to save a severely damaged limb before it was too late. I checked his arm again. The pulse was still there, but weak. The color wasn't good. The clock was ticking, and everyone in the room could hear it. Mr. and Mrs. Harrison, Claire said, and she looked genuinely pained. I understand this is an impossible situation. I wish I had better options to offer you. After she left, the silence in the room was suffocating. I adjusted Marcus's pillow, checked his foreline, did all the small tasks nurses do. But really, I was just trying to give them a moment. Trying to be useful in a situation where nothing I did could actually help. What do we do, Rebecca? Jenny suddenly asked me. You've worked here for years. You've seen cases like this. What would you do? I froze. Every nurse has had this moment. The moment when a patient or family asks for advice that we're not supposed to give. We're not doctors. We can't make medical recommendations. We can't tell people what to choose. But how do you look someone in the eye and say I can't help you when they're drowning? Mrs. Harrison, I said carefully, I can't make this decision for you. But I can tell you that whatever you and your husband decide, it doesn't mean you failed. It means the system failed you. She started crying harder. I got her tissues. It's such a small thing, tissues, but sometimes small things are all we have to offer. Marcus was staring at the ceiling. This can't be real, he said. This can't be how this works. You get hurt at work, and then they ask you to choose between your body and your bank account. This can't be real. But it was real. I'd seen it dozens of times. The patient who declined necessary surgery because they couldn't afford it. The family who had to choose which medication to fill. The elderly woman who left against medical advice because she was terrified of the bills. This was American healthcare. This was normal, and I hated it. Dr. Chen came back in. I could see she'd been crying. Her eyes were red, though she'd tried to hide it. Mr. Harrison, she said gently, I need your decision. We're running out of time. What are the real odds? Marcus asked. If you try to save my arm, what are the real chances it'll actually work? I watched Dr. Chen's face. She could have given him the hopeful version. The best case scenario. The success stories. Instead, she told him the truth. With this level of damage, maybe 40% chance of getting useful function back. 30% chance of chronic pain that never goes away. 20% chance of infection that would require amputation later anyway. I felt sick, because I knew what those numbers meant. I knew what decision Marcus was going to make, and I knew it wasn't really a decision at all. And if I choose amputation now, Marcus asked quietly, modern prosthetics can restore 60 to 70% of normal function, Dr. Chen said. Faster recovery, less risk of ongoing pain. The room went silent. I could see it happening. Could see Marcus doing the math in his head. 40% chance of success with massive debt versus 60 to 70% function with no debt. Medical risk versus financial risk. His arm versus his family's future. Do it, Marcus finally said. The amputation. Marcus, Jenny gasped. Do it, he repeated. I can't put our family through this. I can't risk everything on a 40% chance. I had to turn away. Had to pretend I was checking something on the monitor so they wouldn't see my face? Because this wasn't medicine. This wasn't healthcare. This was a man being forced to cut off part of his own body because he couldn't afford to keep it. Dr. Chen asked if he was certain. Marcus said yes, though I could hear in his voice that he wasn't certain at all. Then Dr. Chen said the words that I still hear in my nightmares. You choose. Save your arm or pay $80,000. The room went completely silent. Even the monitors seemed to stop beeping. I looked at Dr. Chen. She looked devastated. She hadn't meant it cruelly. She was just stating the impossible reality we were all trapped in. But those words hung in the air like poison. Marcus's hand was shaking. I reached over and took at his left hand, the good one, and held it tight. I'm sorry, I whispered. I'm so sorry this is happening to you. He didn't say anything. Just squeezed my hand back. Dr. Chen said she'd prep for surgery. Then she left, and I could see she was barely holding it together. Jenny climbed into the hospital bed next to Marcus, careful of all his tubes and wires, and just held him while he cried. I stepped back, giving them space, but I didn't leave, because someone had to stay. Someone had to keep monitoring his vital signs, adjusting his medication, making sure he was medically stable even as his whole world fell apart. That's what nursing is. We stay. One of the surgical prep nurses came in to start getting Marcus ready for the operating room. I helped transfer him to the surgical gurney, made sure all his I-4 lines were secure, checked his charts one more time. You'll be okay, I told him, though I wasn't sure I believed it. Dr. Chen is an excellent surgeon. She'll take good care of you. He looked at me with eyes that had gone dull. Will I? He asked. Will I be okay? I didn't have an answer for that. They wheeled him away at 7:42 a.m. I watched him disappear down the hallway toward the operating rooms, and then I went into the supply closet and cried. Just for 2 minutes. That's all I allowed myself. Because there were 11 other patients waiting, and they all needed care too. But in those 2 minutes, I let myself feel the rage and grief and helplessness that I usually kept locked away. This wasn't what I'd signed up for. When I became a nurse, I thought I'd be helping people heal. I thought medicine was about making people better. I didn't realize I'd be participating in a system that forces people to choose between their bodies and their bank accounts. After Marcus's surgery, which went perfectly, from a technical standpoint, I volunteered to be his recovery nurse. I told myself it was just part of my job, but really, I needed to see him. Needed to know he'd survived not just the surgery, but everything else. When he woke up in recovery, the first thing he did was look at his right side. At the space where his arm used to be. He didn't cry. He didn't scream. He just stared, like he was waiting for his arm to reappear. Like his brain couldn't accept it was really gone. Mr. Harrison, I said softly. You're out of surgery. Everything went well. How's your pain? Gone, he said flatly. My arm's gone. I meant your pain level, on a scale from, I know what you meant. He said, then quieter. I'm sorry. I'm not, ... I'm not okay. You don't have to be okay, I told him. What happened to you wasn't okay. He looked at me then, really looked at me. Does this happen a lot? People having to make choices like this. I wanted to lie. Wanted to tell him he was a rare case, an exception, an unlucky outlier. But I couldn't. Yes, I said quietly, more than you'd think. And you just, ... Watch it happen, over and over. Yes. How do you stand it? I didn't have an answer for that either. Over the next few days, I checked on Marcus whenever I could. Watched him struggle with the phantom pain, the sensation that his missing arm was still there, still hurting. watched him learn to do basic things with just one hand, watched the reality of his situation sink in deeper every day. But the worst part was watching the financial aftermath. Workers' compensation disputed his case, said that since he'd chosen amputation instead of fighting for limb salvage, they shouldn't have to pay full benefits. The irony was sickening. He'd chosen amputation to avoid debt, and now he was being punished financially for that choice. Morrison Manufacturing laid him off 3 months later. I found out because Jenny came back to the ER one night not as a patient, but to find me. "I wanted to thank you," she said, "for being there that day, for holding Marcus's hand, for being kind when nothing else was." "How is he?" I asked. "Surviving," she said. "Adapting. But he's not the same. I don't think he'll ever be the same." "I'm sorry," I said, again. "Always sorry. Forever sorry. But sorry doesn't fix anything." "It's not your fault," Jenny said. "You were the only one who treated us like humans that day. Everyone else treated us like a billing problem to be solved." After she left, I sat in the break room for a long time, thinking about what she'd said. I'd become a nurse because I wanted to help people, wanted to be there during their most vulnerable moments, wanted to make a difference. But what difference was I making in a system that treated patients like Marcus this way? I started paying more attention after that. Started noticing how many of our medical decisions were actually financial decisions in disguise. The patient who chose to refuse a CT scan but really couldn't afford the $3,000 cost. The family who decided not to admit their elderly mother but really were terrified of the bills. The man who opted for less effective medication but really, his insurance wouldn't cover the better one. We called them choices. We documented them as patient preferences. But they weren't choices. They were people being forced to ration their own health care based on their bank account balance. And I was part of that system. Every time I handed a patient their discharge papers, I was handing them bills that might bankrupt them. Every time I scheduled a follow-up appointment, I was scheduling another financial burden. Every time I explained treatment options, I was really explaining which options they could afford. I brought it up at a staff meeting once. Don't you think there's something wrong with a system where patients have to choose between medical care and financial survival? The nurse manager looked uncomfortable. "Rebecca, we're here to provide medical care, not to fix the healthcare system. But how can we provide good medical care when patients can't afford it? That's not our problem to solve." But it was our problem. Because we were the ones standing there, watching it happen. Watching people suffer, not because medicine couldn't help them, but because they couldn't afford to be helped. 3 months after Marcus's surgery, I put in my notice. The nurse manager tried to talk me out of it. "Rebecca, you're one of our best nurses. You can't leave because of one difficult case." "It's not one case," I said. "It's dozens of cases. Hundreds. And I can't keep being part of a system that treats people this way. So what are you going to do instead?" I didn't have an answer yet. Still don't, really. But I knew I couldn't keep standing in trauma bays, holding hands while the system crushed people. On my last day, I wrote a letter, not to the hospital administration. They wouldn't care. Not to the insurance companies. They'd never read it. But to other nurses. To the people who stand where I stood, watching helplessly while patients make impossible choices. I wrote, "We are not powerless. We cannot fix the system alone, but we can bear witness. We can document what we see. We can tell these stories. We can refuse to accept that this is normal, that this is okay, that this is just how things are. We can stop pretending that patient choice means anything when the choices are go bankrupt or go without care. We can stop using sanitized language to hide ugly realities. We can stop being complicit in our silence." Someone asked me how I could stand it watching people suffer because of a broken system. The truth is, I couldn't. I can't. And if you can't either, that doesn't make you weak, it makes you human. The system wants us to be machines. To document, process, and move on to the next patient without feeling the weight of what we witness. But we are not machines. We are humans caring for humans. And when the system fails them, it fails us too. I don't know if anyone read it. I don't know if it mattered, but I needed to say it. My name is Rebecca Torres. I'm 34 years old, and 6 months ago, I held a man's hand while the system asked him to choose between his arm and $80,000. I was just the nurse. I couldn't make medical decisions. I couldn't change insurance policies. I couldn't fix the broken system. All I could do was be there. Hold his hand. Bring tissues. Bear witness. But sometimes, bearing witness isn't enough. Sometimes you have to walk away before the system breaks you too. I don't know if I'll go back to nursing. Maybe someday, in a different setting, in a different system. But I know I'll never forget Marcus Harrison. Never forget the look on his face when he realized his arm had a price tag. Never forget the sound of his wife crying in a hospital bed, trying to calculate how much of her husband they could afford to keep. The surgeon said, "You choose, save your arm or pay $80,000. But what I heard was, this is what American healthcare has become. This is what we've accepted as normal. This is what we do to people when they need help the most. And I couldn't accept it anymore. So I left. Not because I stopped caring, but because I cared too much to keep watching. Before I go, I need to tell you something. I'm not the only healthcare worker who's walked away. Thousands of nurses across America are burning out watching patients like Marcus make impossible choices while we stand there, powerless to stop it. We hold their hands, bring tissues, and check vital signs, while the system destroys them. If you've ever felt powerless in the American healthcare system, hit that like button. You're not alone. Follow this channel for real stories from behind hospital doors: medical ethics, healthcare injustice, and what really happens when insurance companies have more power than doctors. Tell me in the comments, are you a healthcare worker burning out? Have you been trapped between medical care and financial survival? What would you have told Marcus that day? And if you're a nurse thinking about leaving, you're not weak. The system asked you to participate in something inhumane. Walking away doesn't make you a quitter, it means you refuse to let it break you. 2. Subscribe, like, share with every healthcare worker you know, because we need to stop pretending this is normal. 3 months after I quit, someone asked if I regretted leaving. I said, I regret that I had to choose between my mental health and my career, just like Marcus had to choose between his arm and his family's survival. This system forces impossible choices on everyone. Thank you for listening. And thank you for refusing to accept that this is okay. Because it's not.